Welcome to Innersight, Health Optimization with Rudy and Sean.
Right, here we go. Innersight podcast. Sean, we are sticking with the theme of our previous podcast, where we said movement is medicine. And we're actually talking about one of the organs that has been overlooked, not by us, but by the medical community. And we're talking about muscle today.
Absolutely. I think in the view of longevity, we don't want to focus on one specific element of exercises or specific movements. You need to incorporate everything. You need endurance, you need flexibility, you need mobility, and you need strength. So today we'll touch on the strength, and that's why we've got Hannes back. Hannes, you've done some podcasts with us in the past, but for the people that might not know you, can you maybe do a quick introduction?
Yeah, sure. No, thanks. It's nice to be back. I'm Hannes. I'm a biokineticist that practices in Cape Town and Durbanville for 16 years already. I specialize in injury rehabilitation and specifically running, a little bit of cycling, including a little bit of performance as well. Yeah. So that's a short history of my background. And this theme is what we're talking about today is very, very, very at the forefront of rehabilitation and performance. But I think like we'll talk today as well, general health as well. In the last couple of years of research has been amazing on the importance of strength in health.
So I met Hannes some years back when I injured my back, and the typical reaction from your neurosurgeon is, you should stop running and shouldn't cycle and things like that. So I went to Hannes and said, Hannes, fix me. And he fixed me. So I've got a lot of belief in what he's doing. So I'm interested to hear what you've got to say today.
So Hannes, I want to take it a little bit back to how we know muscle is important. So in our Innersight 1, we screen the 4 parts of how we think a person moves. So we've got strength, we've got endurance, we've got flexibility and stability. So today we want to focus on muscle as an organ, putting these 4 together, and which ones are things that we can measure, how the person out there would know if they need to do something different, and give some plans. So maybe as a start, can someone do a home assessment? Is it better to be assessed by you, or how would you know that you are lacking? What is the first signs that people should look out for and say, okay, or when they start training, is it better to have a full assessment? How do you guys think about that?
So I think the easiest place to start is to have start with a subjective review of your lifestyle, to just monitor and see realistically in the last six weeks to 3 months, how much am I actually moving in terms of walking around and being physically active, steps per day, not necessarily exercise, but your day-to-day activity, and how much of the time, or how many times am I actually moving against the resistance, a little bit outside of my comfort zone, picking up heavy things, walking up a hill where there's an amount of exertion. Because when we refer to strength is, if you want to break it down to fundamental level, is the amount of force that your muscles can produce, the force that your muscles can produce against a resistance, so that and even just walking, your muscles are producing some strength. As we are sitting here, we have hundreds of muscles working, and the human body has hundreds and hundreds of muscles to move us. So the first question is, how much am I moving? So obviously with today's lifestyle and how our day-to-day activities like work and life is structured, there's not a lot of opportunity for movement for a lot of people. If you've got a 9-to-5 office job, you're sitting probably much more than what 5 generations back did in their day-to-day work. So one of the implications is you don't have the ability to move the body outside of its comfort zone. Now, in terms of strength, the muscle's ability to produce force is very much a use it or lose it principle. So a first start of measurement is to have a look and see how many times a week, a month are you spending outside of your comfort zone when it gets to movement. So that's a good starting point. Now, you don't have to see someone like me to do a full assessment if you don't have any injuries or any health risks that might correlate with or may be associated with exercise. A good place to start is just start with something very basic. If you don't know what to do, then I would say start maybe consult someone that has some experience in strength training. So I think
So I'm going to interject there. Just because I think for the price of not eating 5 pizzas, I think it's actually very good to go and have a baseline. So I know you're selling yourself short by saying you should not go, but I do, or for my own, what I've seen with what we have seen with the people that we screen, no one has got nothing. Everyone's got an issue. And even if you think you don't, there is something lurking. So, okay. But
Yeah, and I want to also say something about it, because every patient that I do see, I recommend, if you want to start with resistance training, please go see the bio first to get the baseline, and then to see which areas might need more help than other areas, and as well not to injure you. Because often I get the scenario where someone has gone to the gym, and please, this is nothing against personal trainers. There's many very good personal trainers out there. But so often I see someone going to the gym and they get a personal trainer and they get injured. Either due to something that they did themselves, or maybe the program wasn't for them. So my feeling is still that you need to see someone if you're not comfortable doing the exercise. If you're not used doing exercise, if you don't know what to do, go see a bio that they can test you and then build up your program from there. I do feel that's quite important.
I like that, just for the reason that for the general person out there, because we move in this sphere all the time, and we can move through the weeds and see what is wrong or not correct in an Instagram post. But I mean, 10,000 steps is something, or picking up, can you pick up something is also something, but to pick it up correctly is very different to, yeah, I can maybe do it as a 25-year-old, but and that maybe brings me to the next step, is what we need to focus on here, is that most people have muscle up to a point, but I mean, you start losing muscle at a certain point. So we probably need to say to the people out there, that is probably most of the reason why you need to see someone, because you are in this continuum of an age. You're going to live somewhere between 0 and 100 years, however, where you're going to end. But where you are in that continuum is, it needs to be seen by someone like yourself and say, okay, but you are 50 years old now, and where you are now for your expected, you are too low. You need to move stronger or faster. No, maybe not faster, but more endurance.
Yes, and I think, as you said, like up to about 30 years of age, you build muscle and you've got your muscle mass. From there onwards, you start to lose about 1% of your muscle mass over time. And then once you reach 70, that's like 3-4% of your muscle mass per year that you lose. So, but you can change that by doing the right things. So in essence, if you're a young person and you're active, it's not a problem. I think the problem starts from the older people. If you in your mid-40s onwards, I think that's where you need a lot of help in what you need to achieve then.
So I've interjected you by saying you must not. So let's say you test someone. Okay, I think we've convinced our crowd that we need to be tested.
We need to see Hannes.
Yeah. So the point that I'm making there is why I started at that point is because is something is better than nothing. That's the fundamental thing. And there are individuals that me and you don't see that is doing absolutely nothing because there's a little bit of resistance to strength training or any form of strengthening up. And that's the first thing is you have to take that resistance out of the way. Okay, that's a good starting point. Okay, but like you said, with strength. With strength training, where it's different from cardiovascular, where I would say just start walking around the block once a day or once every other day. The devil's in the detail, because now you have to get stronger. You have to actually challenge your body outside of your comfort zone. And that's where the risks that you are pointing towards the weaknesses and the deficits gets exposed quite quickly. And you do need some guidance on that. So I usually recommend then when you start there, let's assess the fundamentals in terms of how strong are you? Do you have any injuries that might get exposed if you do start strength training in the gym, or just like with a circuit or anything like that? And then if we do know where you are now, determine where do you want to be and where do you need to be for health and longevity. And this is where the details, what age you are. So someone at 40 that listens to this and you realize, if I start strength training now, the benefits in 30 years is going to be massive. Is going to the guidelines and the the goals and the path that he's going to follow is going to be different than the 65, 70-year-old that said, I've never done strength training before, but I want that health benefits. That path is also going to look different. My assessment of when I see someone like me is we assess to see where are you now and where do we need to get you in terms of strength and how we're going to get there. And that's the first step. And how we assess that is couple of basics. There's a couple of basics way that we can do that. I use in my practice isometric strength testing. So what I test is what that basically means is we have a device that you push against that there's no movement, but I measure how much force each muscle can produce in like a 3-second period of time. We call that peak isometric force. And we do that for all of I like to do that for the important muscles, which is the muscles that move the knee, the hip, and the shoulder. Grip strength is something that gets tested a lot in the research, and it correlates quite strongly to a lot of health benefits, more grip strength, better health outcomes in general. What I found is looking at the research is the grip strength is a proxy for general upper body strength. So yes, you can improve your grip strength, but it's more a result of being physically active with your upper body. So I like to also include especially shoulder strength around in that assessment. Knee strength is a good metric because that serves as a window into how strong the leg the leg is, and also use it as a baseline to see, are your legs getting stronger? A stronger leg, you're going to use more. It's not going to fatigue as easily, so you're going to walk more. So there's there's secondary benefits into the other spheres of training. So better you're going to be able to walk further, so you get more cardiovascular stimulus and the zone 2 benefits that we've talked about in the past. It's easier for your muscles to coordinate, to stabilize you. Stronger muscle can listen to the brain better and respond quicker. So it's also, again, I like to see it as a proxy for general strength. But we do want to, so that's a good starting point, is have a look at each muscle, all the important big muscle groups that need to move you. Test that strength. What I like to use those tests as well is to identify deficits and compensations over the years. So let's say the left leg we test much weaker than the right leg, and then we can explore. But why is that? Because that's not something that happens on your own. Let's go, if you test someone that is 65 years old, and we see, okay, but there's a 25% difference between the quadricep of the left leg versus the right leg. And when you dig a little bit deeper, then we know, okay, actually, I had an episode of lower back pain 15 years ago where I had referred pain down the left leg, and that influenced how I walked for 6 months. And when you walk a little bit different because of the presence of pain, practice makes perfect. You learn that habit, and the muscle that's supposed to do a certain task that doesn't do it that much, and then this deficit develops. So now we've actually also used as a secondary advantage the strength testing to see, are there any compensations and deficits that we can also address with strength exercises. That's the first starting point. What I like more is to progress it to more of a functional view of muscle strength, because muscles don't work as individuals when you train them. So the quads never work on its own. Even when you're sitting on the leg extension machine, the rest of the body is bracing you to actually extend the knee against the resistance. But that's isolated incident. In everyday life, everything works as a system. So this is the stuff that we've said in the past about how important stability and control and the software behind muscle strength is also quite important. Because if you are going up a step which requires quadricep, calf strength, hips, and glute strength, or even running, let's use running as a good example. The person that can squat or leg press the most in the gym is not going to be the fastest person, because if you have a lot of strength but you don't have stability, you don't have the ability to reproduce that strength in an everyday task. So I like the analogy here of comparing a hose pipe versus a steel pipe. Both of these pipes are very strong. You're not going to break them, but if you're going to try and press them into the ground, it's going to be easier using less effort to get the steel pipe into the ground, where the hose pipe is going to take much longer and to get the same outcome because of the stability factor. So your strength training, where you start off with the basics, get each muscle stronger, you want to progress to more functional multi-joint exercises like your squats and your lunges, and yes, even something like a deadlift if you do the technique correct, all the criteria you need to tick. Those are better exercises to do. Free weight exercises are better than machines, because the machines, it's almost like you outsource the stability factor to the machine, where when you do leg press, but when you do a squat holding dumbbells, there's a certain degree of stability required to do the exercise. So that's the type of exercises you want to progress to. So getting back to the first assessment when you see someone like me is to see where are you now, and how can we get, if you have no goal, you just want the benefits, how can we get you there by doing those type of exercises that is going to start simulating what you do in everyday activity. And even if that's for running or just just basically playing around the pool with your kids, the pathway it's gonna look a little bit different at the end, a little bit specificity, but it comes down to the same fundamentals. Is you want to improve the hardware, which are the muscles, but you also want to see if you can address the software as well, the nervous system and the stability required to coordinate good movements so you can produce a lot of strength.
Yeah, and I like the way that you put it, that it's multi-joint movements that you do, which are functional movements, because that's what you do in life. You use all your muscles and joints and stuff to do things in life. With the machines, you refer to that, which is nice if you've got an injury and you want to protect a certain joint in doing the exercise, or purely for if you want to build muscle without necessarily the other factors associated with it. But to have a functional strength with the balance and all the other input, that's quite important for longevity.
No, definitely. And but there's a role for, if you go to the gym and the strength machines as well, for if you've got the greatest stability in the world, but you actually just need to get your legs stronger. But the leg press is a fantastic exercise to do it, to really focus on building that raw strength in the muscles, and give you the opportunity to really overload the muscles to get it to adapt. We'll get to that part now, because that's when I mean the devil's in the details. How much of it are you doing enough to stimulate adaptation? But even leg extensions, that gets bashed a lot. It's not good for your knees. We use that in rehabilitation of certain sports injuries to great success. If the quadricep is quite weak, with certain injuries like ACL reconstructions and so forth, to get that strength back, if it's safe to do, it's a great exercise to work the muscle in isolation, because everything else is there. It's a rugby center that towards ACL is advanced stages of rehabilitation. He can jump already, but that quad strength is still behind. We'll use leg extensions to get that stronger. Great exercise then, in conjunction with everything else. Yeah. So it's just, I think, if there's nothing wrong with you and you have built some strength and stability, then if there's just that added benefit of going to more free weight type of exercises, like your squats and your step ups and your single leg deadlifts and those type of things.
So those two are very much connected, strength and stability. So doing strength training won't really give you endurance and not flexibility really, but it will definitely help with your balance. Have I got that clear?
Yeah, so very interesting. Is good you said that. That's strength training is actually if you do certain exercises through the full range of movement. The full range of movement is actually great for flexibility. So, for example, in hamstring strains, what we do is to get in calf strains in runners as well, to get the fascicle length is basically the muscle that was damaged to work it through its whole range of movement and get the length back and able you want a hamstring that was injured to be able to contract at its full length. A better way to get that flexibility back is to do it under load. So like a stiff leg Romanian deadlift would be if you do it very controlled and you take it to end range within its capacity, it's a better way to get the hamstring flexibility back than actually doing a hamstring strength. And that's something we use in sport. So believe it or not, strength training can have very good benefit for flexibility as well if you apply certain criteria. So if you do it right, if you do certain exercises more than others is maybe better. But if you do it through the full range of movement at load, can be better for flexibility. For stability, yes, if you do like free weight type of exercises is great for that. For example, one of my favorite exercises to do with runners is single leg deadlifts or even RDLs, is where you doing basically a hip hinge, or let's say use a single leg squat. Single leg squat is really demanding on the leg, but you need a lot of stability as well. Yeah, so it's not the exercise I'll do on day one, but we'll do it after a couple of months of really conditioning. It's a great exercise, and then you're doing strength and stability at the same time. So then the two go hand in hand. I like to explain it like this. This is let's use the context of someone that has a knee injury. To get the leg stronger to run again. And with running, there's high demands on the knee, for example, 4 to 5 times your body weight. So you do need to do the core rehabilitation for that is strength training. You need to condition the leg back to handle the knee to handle that strength conditioning. But before you do the strength training, I say before we upgrade the hardware, we need to update the software first. So you can't really train the leg for something like running where you need that single leg stability if you don't have the stability. And then so a lot of times I'll train that as a precursor for the strength training, and later on becomes the same. At a later stage, it's not two separate exercises; it's the same exercise that does both, depending on what you do. For example, if you want a rugby player you need to get him to be quite strong. He's a forward. Then I would actually move a little bit away from the stability, because the stability does limit how heavy you can load the muscles. So then I would focus on pure strength and actually put the stability on the back burner in this case. So again, it depends on what you're working for, but I think for general use, the two go hand in hand.
So you mentioned that you're testing strength as well, mainly, but do you also do power testing in the sense of like jump heights and things like that? Or do you have power plates that you sometimes use
Yes.
as a measurement?
Yeah. So yes, we use certain cases. People have access to power plates, these plates that you can jump on. I've even got software on my iPad that correlates very strongly, where we do explosive power, where we do jumping tests that correlates strongly to using something like a power plate. So power is what comes after strength, and this is the difference here. Is power is basically the maximum amount of strength you can produce in the shortest amount of time. So it's really quick movements against big loads and big resistances. So like a jump is a power movement. You have to get your whole body weight off the ground and absorb it landing against the on the floor again really quickly. So where you do, for example, a squat, if you squat down and you push yourself back, you have a couple of seconds to produce that force. When you jump to get off the ground, you have to produce that in less than a second. That's what power is. So what happens is, and this we see in a sport like running is a good example, is when you run, you're only spending 300 milliseconds with each foot strike on the ground. So you can have the strongest leg in the gym. If you can get close to your maximum amount of force within 300 milliseconds, you're using a very small percentage of that. And this is very oversimplification, but to make my argument, this is, I'm going to run with this analogy. So to get that if you have a lot of strength, that's the first thing you need to do. That we try to do with the sports people is build a big engine. So that's the strength exercises. That's your leg presses and your squats. Slow movements really get the muscle tired.
Because you can't have power without strength, but you can have strength without power.
Yes.
Absolutely.
That's yeah. So yeah, because you need power is the your power, if you don't have the strength, is basically going to be you're going to produce you can maybe produce have a quick muscle contraction, but if the engine is small, the outcome is going to be very minimal.
And that's also, as we age, we often keep quite a bit of strength, but we lose that power. And that's a typical thing that we see in age, and it's very related to the type 2 fibers that we lose as we age.
Yeah.
So I think that's the one thing that we don't really test that in our program as such. We test the strength because it's a nice measurement if you want to follow up someone. But in your case, something to test power is also nice too, for that cherry on top type of conditioning.
Yeah, no, definitely. And power is, with the populations that I work with, and apologies for just referring back to runners, it's 99% of the people I see is they do need power. But so that's usually the final phase of rehabilitation. For example, someone that has Achilles tendinopathy, it's the how you treat an Achilles tendon is you need to load it and build its capacity to handle back, load back up. But for running, that tendon is experiencing 7-8 times body weight forces every step that you take within 300 milliseconds. So if you can do calf raises against heavy weight, but you're not teaching the calf to contract really quickly, you're not using that strength that you've built up. So that's where the explosive exercises come in. And it doesn't have to be jumping though. So a good general power exercise is, if you've been doing squats and you're getting quite good at it and you've actually increased your weights in the gym a bit, doing a couple of weeks or a training block of where you do higher velocity squats, where you basically just do a sit and stand holding dumbbells. I usually tell people, let's go a little bit lighter or start without weights, even though you've built up strength. But now it's all about moving quicker instead of heavier. You add the weights as you improve as well. The metrics for that I usually suggest do it under guidance, because you're not going to do your 6 to 12 repetitions of that. That's maybe you can be less like 4 to 6 repetitions.
Do you do it like a slow down, fast up, or doesn't that matter so much?
It depends. I like to go slow down, fast up at the beginning, and then if they've worked really hard and they've progressed nicely and very comfortable with the exercise, then I'll start doing fast up and down. But that's much later down the line. That's what you want to work towards initially. Yeah, because that's the type of things that gets that gives you that power benefit, is doing the exercise you're already doing, and if it is safe to do, start doing it quicker. But you first have to do it slow. Yeah, you can't just do it quick. Yeah. That's why I actually say the first couple of weeks and months of your strength training is slow. The nice term about that we use in sports rehabilitation is heavy slow resistance training, and that sums it up perfectly. That's how you build strength: slow, heavy movements up close to what they call muscle failure. Okay,
so it's quite interesting. Yeah. Sorry, Sean. Yeah. That in the training world, it was the big gladiators first, like big muscles, and then it changed a bit to endurance. There was quite a lot of focus on endurance, probably last 10 to 15 years, and now it's swinging a little bit towards the strength and the power again, which you were saying you're seeing 90% of your people are runners, but that is great that you're talking about strength, because runners, cyclists, they are now back in that they need the strength to build the power.
Yeah, I think it's the concept that you need all of the factors. You can't just have the one. But I think up to now we've talked about strength and power and stuff like that. We haven't mentioned size in any of the conversation. And I think it's important to talk about it, because I think a lot of the resistance training in the female population is that they don't want to look big and strong. But it's actually not that easy to build muscle. We're talking about building strength. And I think the concept sometimes for some people is that I don't want to do resistance training because I don't want to look too muscular. I don't want to look like someone going to the gym. And the reality is it's not that easy to build muscle. And we're more talking about actual strength. And also the studies that with the longevity studies, it's based on grip strength and things like that. It's nothing to do with muscle size. Yes, I suppose there's a correlation between muscle size and strength sometimes. But the reality is that female patients, the women out there, shouldn't be scared of doing resistance training. They're not going to look like Mr. Hulk suddenly.
No, definitely not. So there is definitely a correlation between muscle size or the diameter of muscle and strength, but it's not just that. It's you can actually go and have a look at some of the endurance athletes, some of the professionals, like especially the ultra trail runners, some of their routines, and also the Ironman elites. These aren't big muscular people, but go have a look at what they do in the gym. They're pretty strong. These people, these athletes, and the reason for that is it's not just muscle size. Muscle size is a factor, but also the recruitment of the muscle, how many of certain types of muscle fibers you have, how efficiently your nervous system can coordinate the different muscle groups, the muscle groups to produce like a squat, for example. Then what was the other one? The rate of force development of the muscle also tells us how much you can do, and you don't have to lift the heaviest to get the benefit. Just that little bit of overload of building up is going to strengthen you before you even see the muscle actually getting bigger. And that's why I like in the first assessment what's the level you want to get to, and if the level is I just want to pick up my grandchild. Yeah. So, okay, your grandchild weighs 25 kilograms. So your strength training is going to be, you must be comfortable to do 25 squats with 25 kilograms. Let's say 3 sets of 6 to 12 repetitions. Then you're going to be strong. I promise. No, maybe I should not say promise you. It's highly unlikely you're going to be a bodybuilder reaching that goal. Okay. If your goal is to create muscle mass, then your training programs will look like it's a lot of weights, a lot of repetitions, a lot of sets per week for a muscle group to get that benefit. But for example, if you want to build muscle now, this is my talk under correction here. The number of sets that you have to do per week for a muscle group to get it bigger it's quite high, and you're going to train to failure to achieve that with everything else, with the nutrition that goes with that. The recommendations for trail run, for any endurance long distance runner to get a strength benefit to improve the running economy, the minimum requirement is something like 60 to 90 minutes of strength training in a week. That can be as little as two to 30 minute strength training sessions for all the running specific muscles. So that runners can be very, very strong in the gym, but is not going to build a lot of muscle mass, and that runner is also not training to failure, because this is also important metric to get the muscle stronger. We maybe deep dive into can talk a little bit about how much is enough to get a muscle stronger. But for endurance strength training, we only train to 80-90% of your one repetition maximum. Okay, and that's basically so that means you're going to train and not. I like to call it the reps in reserve principle. You're going to train up until 90% of your maximum between 6 and 12 repetitions. That's usually the guideline I use. You don't want to train to failure, because what they found then is you carry, especially someone that's training high volumes, you're going to carry too much fatigue into your runs, and that negatively influences your main activity. But 80-90% is enough to get a strength adaptation. Maybe not enough to get a hypertrophy of the muscle growing, but the muscle does get stronger. So I'm usually looking at the endurance world and how they apply strength training and see how strong they actually get with much less training than someone that actually wants to build muscle. That's I think a little bit more reassuring.
Yeah, and I think that's a good point as well, that if you enter into a training program, you can decide if I want to build muscle, if I want to build strength, and design your program around that. So it's the barrier to entry to do resistance training shouldn't be there. The data suggests that it's beneficial in many factors. So yeah.
So what that says to me, the practical for the person out there is, if you're doing nothing, you need to start doing something. But for the person that runs a 5K 2 or 3 times a week and they don't have some type of a weight training, they're holding themselves back. So you need to do something to progress. Just normal endurance is not enough. And that's for the guy with a bicycle or the runner. You need to pick up heavier stuff.
Interesting study they did for running was it was in the last year or two. They found what's the actual benefit of adding strength training to the runner, and the big benefit they saw is it actually delays fatigue at the end or slowing down at the end. So that's where the performance benefit is. So if you're doing your first 21 and or if you've done a 21 in the past and you say that last 5Ks I'm actually my legs are dead. One thing that you can add is add some strength training to maybe delay that onset of fatigue at the end, so you can run and end stronger. Okay, so it's a very easy addition, and like I said, the barrier to entry you don't have to become a 5 days a week gym enthusiast. You twice a week is a good starting point. 30 minutes to get some form of benefit.
So a question on that is, like, obviously we'll promote, say we would like whole body exercises, exercising all the muscles. With your runners and cyclists, do you predominantly do strength training in the running muscles, or do you do full body, whole body type of exercises?
Yeah, that's a good question. It depends. Very interesting how much time they have, because a lot of them already training a lot, and it depends on the level. And even the recreational runners already running 3 or 4 times a week and working a job and have 2 kids at home. The time is usually very limited. Then we'll say, okay, let's work on the essentials. You are here to be better at your cycling, to do the cycle stronger, and you've heard strength training is good for you. Let's start with very basic running, cycling specific exercises, just to get a full body, get your upper body included there. We'll add like a pushing exercise and a pulling exercise to cover the upper body, and that keeps it nice and short. So that's what I'll do in that cases. Ideally, you want to work everything. So individuals that train with me for that benefit or is busy with rehabilitation for a knee injury, if they are seeing me on a weekly basis, then I know I've got like a 50-minute session with them. I actually have some time to do the upper body strength training and the core and back and all those exercises as well. Our main focus is getting the knee stronger, but that's going to be maybe 25 minutes or 30 minutes of our session. The next sessions we can do all these secondary benefits as well. And something like mountain biking, it helps to have a stronger upper body, so it does play into that anyway. General for the general person coming in, a little bit of everything is good. Yeah.
You touched a little bit on nutrition when you said about hypertrophy and all that. We had a podcast that we talked about creatine specifically. So is it out there now? Like, I mean, we are big believers in creatine. So is it out there that it in your runner world as well, or?
Yeah, so here I usually refer to the sports dietitians that I work with too. But yes, it's the benefits does seem to be there. I'm not too I don't really spend too much time on the specifics of it, but yeah, it does seem like it does have a positive effect, and with a very basic dosage and amount. Yeah.
Okay, and then obviously the other thing that's been in the news quite a bit, and maybe you get asked about that, the protein, how much and all that, or do you just refer that straight to
that? I usually refer to the sports dietitians. Yeah. So especially if it's active individuals, I like working with a sports dietitian because it's a balance in terms of you need if you're adding strength training, you need a certain amount of protein is going to benefit the muscle growth and strengthening, but also you need the fuel to do the exercises. So that balance, it gets a bit technical. I'd I don't always have the time in my session to cover that, but then I refer to my neighbors.
Because I mean, that's quite a big part of our biochemical inside, is that the muscle is like a big store of glucose or glycogen. And I mean, you can literally say if someone is a type 2 diabetic by doing a muscle biopsy. So I mean, like you say, the fuel can be too much, then you're diabetic. And if you start using the muscle, you can actually use quite a lot of this fuel and actually exercise yourself out of type 2 diabetes. So I mean,
Well, I think this is the point we've been rambling about muscle strength and training and stuff. But why is it important? And it's exactly that. The muscle is a endocrine organ almost. And as you said, with type 2 diabetes, the muscle, we store our glucose as glycogen in the muscle. So the more muscle you have, the bigger the sum. So it's beneficial in the metabolic sense. You also secrete some hormones and endocrines and stuff when you exercise, when the muscle contract, which is beneficial for longevity. So, and the studies show that people with strength, the all-cause mortality is lower. So that's why we're all going about strength, why strength training is important. Then you've got the normal factors like the chance of falling if you've got strong legs, and if you've got the coordination and the balance is less, which is one of the major causes of morbidity and mortality if you're an older person. So it's such an important part of your daily exercise regime is to have that strength training incorporated. Sometimes we do see people that is so focused on either just running or just cycling that they tend to forget about the other part of the equation.
Yeah, just back on the nutrition, this is maybe where it fits in. I usually remind people you're not getting stronger while you're doing an exercise. So if you're doing bicep curls and you want to get your biceps bigger, your bicep isn't, the muscle is not getting stronger while you're doing bicep curls. All you're doing when you're doing strength training is you're breaking the muscle down a little bit so that later that day, if you try the same weight, you're not be able to do it. You're getting stronger afterwards. Those hours afterwards, you're not doing bicep curls. So basically, see it if we can oversimplify again. You have a certain baseline of strength. So if you stress the body or stress that muscle, then you start dipping a little bit because the muscle is fatigued and it went a little bit over what it can handle. But then the body starts repairing it, and it repairs it with the nutrients that you take in, and especially when you are sleeping. Very important in terms of sleeping is best recovery tool that you have. But the nutrients that you take in, that protein and that carbohydrates and all those type of things, then you rebuild the muscle. But the brain thinks it's going to happen again, and it moves your baseline a little bit up, and then that's basically that recovery. Then you're a bit stronger. Muscles do work on a use it or lose it principle. So if you don't use it, you go back to whatever your baseline is, and that's your day-to-day activity. So if you've got an office job sitting for most of the day, then that baseline is going to be in a place where you might not be, you don't want it to be. So regular stimulus is actually just forcing this curve up and up and up, and that's basically how we do apply strength training. So that's where the new nutrition comes in, because you need the tools to repair the muscle and force it to allow it to get that adaptation. So the nutrition goes hand in hand. It's quite important as well as
yeah, on the protein, I read an article, a journal article about when to feed, and they said it doesn't really matter when you feed through the day, but the quicker you do, the better. First 90 minutes is the best, but even if you do, like you say, even before sleep, just get that protein in. So, and on that sense, most people struggle with protein. They don't struggle eating enough calories, they struggle with protein because it's quite difficult to get in 2 grams of protein per kilogram of muscle weight, of body weight. And I mean, if that's your number, but I'm just trying to say that people think they eat the 300-gram steak, it's 300 grams of muscle, but it's not. And the egg being 8 grams to get to your number is quite difficult. So and quicker is easier. But
And obviously there's an age thing there, because if you're young, you can absorb proteins quite well, but as we age, it becomes a little bit more difficult to absorb. So we do need more proteins to recover and to help with the building of the muscle and the strength. But when you're young, that you get away with a lot of stuff. So it's not that important to supplement. But once you reach your 50s, then a lot of us will need to supplement with some sort of protein to get to that point where you actually get enough in. The other thing is obviously as we age and muscle and strength, men tend to lose some testosterone, and the females, they go into menopause. So all these hormones also play a role in the ability to build muscle. Fortunately, these days, I think it's less frowned upon to you get yourself back to a normal physiological level, the testosterone or the hormones, so hormone replacement therapy for the female. So I think we're moving in the right direction, because that will definitely help with keeping muscle at the level that it should be.
Yeah, I mean, I'm just sitting thinking. I mean, we've done all these podcasts, and they all just fit together in this human body. I mean, we've done the one about osteoporosis, and the osteoporosis message was load your muscles to build your bone, and this message is almost the same, but it's like build your muscles to build the bone, and then also the software in between. I mean, I think for me, what I've learned today is to go and pick up a muscle in the gym, or I mean a weight to build a muscle is easy when you're 25, but to build the software is where you guys come in. That software is the problem for a lot of people, and I think that's why you need people like Hannes to build the software.
Especially if you've had that period in your life where you've stopped doing things, and then just to get back into the swing of things, sometimes it doesn't come normal. You need to have some help there. Even in in the road of the recovery after my back injury, some of that exercises with the balancing of the ball on my back, at that point you think, what am I doing now? How is this going to do anything? But it makes a huge difference if you approach it in the correct way.
Yeah, a lot of the times I see people that usually in a rehabilitation context, I warn them, look, the first 4 weeks, we're not going to do the flashy Instagram exercises, but if you bear with me and do these boring stuff first, we're laying a foundation. In 6 months' time, you're going to be in a stronger position than what you would have been if you just went into the gym and throwing weights around. One thing I want to mention is we've talked a lot about the quality aspect of strength training and so forth. The quantity is also quite important as well. And there's two factors you have to rely. Your body, if you stay within your comfort zone, then basically you have to go a little bit outside of your comfort zone, because what happens is, let's use the bicycle for analogy. If you're doing what your bicep can already handle, it's not adapting. So strength training needs to be a little bit outside of your comfort zone. But the problem here is you don't want to overdo it, because you can overexert it. So I think what a lot of people struggle with in the beginning is getting the dosage right. They're either too conservative because they're scared they're going to get injured, or they're not conservative enough and they do get injured. So there's a couple of ways of approaching this. What I teach people, especially as you get older, these are important to apply. So the research on strength training shows that if you're doing an exercise and a set of repetitions, the last 5 repetitions, more or less, that you can do before you can't do another one, are the repetitions that are making you stronger. So it seems like someone said, not all the reps are the same. The repetitions that you do when the muscle is tight are the ones that are making the difference to help you get in this zone. So that gives you a little bit of a buffer. So you don't have to go until you can't lift your arm anymore. So I say that say that 80-90%, go to about 80-90% of what you can handle, and try to do between 6 and 15 repetitions is a good starting point. I would say start with at 80%. So what that would be is you do a set of the exercise until you feel you only have you have maybe 1 to 3 repetitions left before you reach complete fatigue. That's a good place to stop in the beginning, because then you get that strength benefit and there's a degree of a safety buffer for you as well. Then we ask, okay, but how many reps? How about I just do 30 reps until that with a very light weight? Some research does show that you want to train, if you want to get to the technical terms, around about 70, 80, maybe 70 to 80% or 60 to 80% for your one repetition maximum, which is basically the maximum weight you can do only one repetition, which I don't recommend you do, but easy way to do that falls between 8 to 12 repetitions. I like to prescribe 6 to 12, 6 to 15 repetitions, and I give the advice. You do anything between 6 and 15. It's not about how many you do, but you have to get to that, let's say, 85% muscle fatigue level in that range. If you can get to 15 and you're not at 85% muscle fatigue, the muscle that you're training, then you can go a little bit heavier. If you're struggling to get past 6, you're actually going to get more benefit by going slightly lighter. And that's a good guideline that I usually give people in the beginning to apply exercise. So doing enough of it is also important, because if you go to the gym and you can do 15 squats with 40 kilogram weight, and number 15 you can't complete, but the trainer or your program tells you do 3 times 10 or 3 times 8, you're missing out on the benefit. But if you're trying to push it every time until you can't pick it up anymore, then the risk maybe in the beginning does increase for some people. And if you don't have, if there is maybe an underlying weakness that doesn't have the capacity to handle that, even though your the muscles you're training can maybe handle that, maybe there's another muscle or joint that can't handle that, it just builds in that safety buffer again. So that's maybe a good guideline to follow in the on the quantity side of things, of doing enough but not overdoing it.
I like that because not a lot of people will know their 1 rep max unless you've been in the gym for quite a while.
I don't recommend testing it.
Yeah, exactly. Exactly. So that's a very nice. I like that.
So in terms of strength testing, back to the beginning of the podcast, what you asked was, how do I test it? So that's how I start. But the more advanced people, I will do a 10 repetition maximum and say, okay, let's do squats and let's see what's the maximum reps you can do 10 repetitions with. And usually for legs, you use leg press or squats, and for upper body, we use bench press. And that's for the more experienced people that just want to get stronger in the gym and see where they are. There are some metrics or some norms that you can compare yourself to. So at a later stage, that's the type of test that you can do, is do like a 10 repetition maximum, and then you can derive your 1 rep max from that and compare that to your age specific and age and gender specific norms, and to see where you are. But that's later on when you're already quite experienced and have been doing some strength work.
I maybe just want to, before we close, just ask for the person. So when you go to your 30-year school reunion and you see the guy that was really strong as a schoolboy, that's let it go a little bit, up to 50, what would you suggest for him to get the same type of vibe going? What type of time frame must he have in his mind? 6 months, a year, 18 months, if he starts a new strength training program?
So that's so when he starts now, at 30 years later, he starts strength training now. People do respond to training differently. A good rule of thumb is, in the first 3 to 6 weeks, there's neuromuscular adaptation. So that's where the software updates. The muscles recruit the muscle. The nervous system recruits the muscle better. So people actually say, oh, you know what? Actually, I can see in the gym, I've been squatting with X weights, and actually 4 weeks later, I'm going to really increase my weights. It's highly likely the muscle started getting bigger or stronger. It's more like the strength you already have, you're just tapping into much better. And that's strength. I mean, that's part of strength. So that's great. After that, about 8 to 12 weeks, then they actually start getting adaptations. So
it's quite quick, huh?
It's quite quick, yeah. Okay. It's small adaptations, but that's where it does start. And then from there, over 6 months, then you should
definitely see
quite a difference. Yeah. So not like you would see with the infomercials, like you have someone have no 6-pack and have a 6-pack after 28 days. That's not true. and that's also six packs are also controversial in general. But that's it does take time, and that's not what you're trying to. It's not the aesthetics of strength training, and the is not a reflection of the health benefits. It can be really.
I think that's a very important
Yeah.
point. Do you want to repeat that?
The aesthetics is not an important metric of the strength training. It's actually just being stronger. Yeah.
That's the health benefit that you're going to get.
Yes, that's where it lies. Yeah.
Great.
But it helps looking better.
Yeah. Yeah.
Thanks, Hannes.
It's a pleasure.
Oh, I think we all learnt a lot, and I every time I sit here, I think, but I've got a fair idea, and then someone like yourself that do it every day just brings out these pearls. And thank you very much for coming out. And
Yeah, thanks for having me. It's lekker.
yeah, we should link again that if people want to find Hannes, and maybe if the other part that we're missing at the moment that we probably have to think about is that dietitian side. So if they want to reach out to you, whoever you use as dietitian, but they can maybe get to you through your social channels or your website. And but I think we've established that you need to have a baseline before you think you can fly.
Thanks.
Okay. Thank you very much.
Until next time.
Disclaimer. This podcast is not intended as a substitute for the advice of your healthcare provider. No doctor-patient relationship has been formed through this podcast. The content here is for information purposes only.